Doctors and nurses, what is something patients do that they think is helpful, but actually makes your job harder? So, when the really nice ones don't ring and then all of a sudden they actually ring, then you go in and they're like, "I'm sorry to be a bother, I've been uncomfortable most of the night, or I couldn't sleep at night." Like, girl, ma'am, buddy, miss, whichever, you should have called to let me know. My job is to make sure you are comfortable and taken care of. You are not a bother because you didn't ring at all for anything, and now I have to check up on you more often because I low-key feel bad that I didn't do my job. And I do love these patients, by the way. They make my job a little more tolerable because they truly need my help. Next story. Coming to the nursing station instead of using the call light. Family members standing in the hallway, staring at you instead of using the call light. Guys, if you're being neglected as well, this doesn't pertain to you, I'm not that insensitive, but escalating to find care if your light has been going off for an extended period, it's fine. This is about the unit clerk sitting there with no call lights on, and instead of using the bell, the family or patient is interrupting me with another patient to ask me to heat up their dinner, or staring daggers at me across the hall like I have telepathy. Also adding, this post isn't about unanswered call lights, this is just about not using the light at all. Everyone and their mother has a story about their call light going unanswered, myself included. This is about the family that stops me mid-med pass in the hall to ask to fix the sink dripping. Use the light and the unit clerk can page engineering. Next story. ER nurse here. People will walk into triage with no or poor knowledge of their own medical history. No knowledge of the meds they are taking or what they are for. It's absurd. I've had fathers bring in their children who don't know their history. If they have allergies, some don't even know their birth date. Next story. Ophthalmologist here. Sometimes family members will help give the correct answers on the eye chart, especially when the parent is their child. And I'll say something like, "What letters can you read on the chart?" And the child struggles, and then the parent will whispers, "It's OFLCT." And me going, "What the hell?" in my brain. You're not supposed to help. Next story. Please take your regular medicines before your appointment. I can't titrate your blood pressure meds if I'm only seeing your unmedicated blood pressure. There are times when you might need to hold meds before a procedure or surgery, but when you're coming to see your primary care doctor, take your meds like normal. Also, we almost never have people fast before blood work anymore. It doesn't make my job any harder, but I do feel bad when people are hungry for no reason. Next story. This is more for relatives, but when a patient brings a family member/friend to translate, I need them to translate, not speak for the patient. I get that you think you're saving time, but I need to hear from my patient in their words, and they need to understand the specifics of what I'm asking or telling them. Also, it's super dehumanizing for us to just talk about a patient in front of them in a language they don't understand. Next story. Going to the bathroom by themselves to dump the hat. "Oh, I didn't want to bother you." Yeah, you're here for CHF, and we've told you a dozen times we need to measure your output. Please stop doing that. Alternatively, going to the bathroom themselves because they didn't want to bother us, but disconnect multiple wires and machines in the process of doing so. And now we gotta straighten everything out. I know it can be hard to get someone to come in for the bathroom, and that's justified to go solo if nobody comes, but not asking at all to even give a chance for someone to come is so frustrating. So what's the word for people who are like, "Oh, I don't want to be a bother, I don't want to be a burden, don't perceive me, I don't exist, I'm my own mouse in my own corner"? I don't know what the specific word is for those type of warriors, anxious people. I've met a few, but they're getting called out here. And you know what? I think that's fine. I think that's cool. It's cool to exist. It's cool to be perceived sometimes. Step out of your shell. You're not a burden to me, and you're not a burden to your medical staff, so just ring the damn bell, okay? You exist, and we still love you for that. Anyway, next story. So, one of the most common things that patients do, thinking it helps, is self-diagnose and come in completely attached to that diagnosis. It's totally understandable. People Google their symptoms because they're worried, but when someone is fixed on one idea, it can make it harder for doctors and nurses to properly assess the situation with an open mind. Next story. When they say nothing has changed when reviewing their meds and allergies, they think it's helpful because the list is long and it will save time, but I need you to verify everything. Don't tell me nothing has changed, then I have to add 4 meds to your list because your doctor prescribed you 3 new meds weeks ago. And shrimp isn't on your allergy list even though you just told me you had a severe allergic reaction to it at your niece's wedding last week? How do we not have that on the list? Well, you went to a hospital 2 states away when you were out of town at the wedding. Hospitals don't have some national system that they all share. And huge thanks to all the people who patiently go over their meds and allergies without complaint. Also, to those who bring a written list or a list on their phone or even pictures of their meds, you are the best. Next story. I'm neither, but I do coordinate surgeries. Please stop making your surgical clearance appointments before we've called you and then get upset when we tell you that the appointment was scheduled too soon and has to be rescheduled. And also, don't lie to us. If you say you have an appointment made, we will follow up. If your surgeon requires medical clearance and you don't do it, you don't get surgery. And stop eating the day of the surgery too. I understand having to be NPO until 1 p.m. sucks, but they make clear pre-op drinks do help. Next story. I've had 2 MRIs and x-rays of my lower back. 2 injections of steroids that didn't help by pain management. Just saw a new doctor who took the time to pull up the scans and explain to me where and why I am getting the pain. I think if we got back to that kind of treatment, there might be less Googling. Next story. I'm a dental hygienist. This is a lighthearted one, but when patients turn their head super far to the side facing you as soon as they lay their head back, yeah, we can't see you when you do that. If you're reading this, please wait for the hygienist or dentist to direct you how to turn your head. Don't guess because that makes our jobs a lot harder. We can't see. Next story. Please stop blaming and being angry at the nurses for everything. We are a part of a team, not the team. We aren't dietary, transport, social work, pharmacy, respiratory, bed control, or the doctor. And we don't work for any of them. We work with them, and we can only do so much. If you are frustrated about something, chances are we are too, and we are trying to rectify it. Please talk to us like adults. Yelling, chastising, threatening, calling your adult children and having them call us from home is not going to get your results faster. Also, if you are a family member in the ER, please do not walk into a room where CPR is being performed and ask what is taking your mother's ginger ale so long. Yes, this has happened more than once. Next story. Deciding not to take your medication or starve or not drink before a test just in case it interferes with the test. We send out appointment letters with clear instructions. Unless you are specifically told to stop something, you should carry on as normal. If you randomly stop things, it's much more likely to result in the test not going ahead. Next story. Coming out of the room to ask me something at the nurse's station because they didn't want to hit the call light and bother me. But now here you are, right in front of me, asking for something, so I have to stop what I'm doing and help you immediately. If you hit the light, I can pick up the phone, ask what you need, and prioritize it appropriately with the other things I need to do. But here you are asking me for XYZ and staring at me until I get up and get it for you. Oh boy. Next story. Random vitamins and supplements are probably more likely to give you medical problems than help you. I don't know what's in those. You don't know what's in those. They aren't really regulated, and whoever told you to take them is probably just trying to sell you their brand of wellness activities or supplements or ideology. There are reasons you would need to be prescribed vitamins, but the average person taking multivitamins doesn't fit that category. Next story. My wife is a postpartum nurse. One of their policies when the new mom comes to them is that their nurse needs to help them with the first 2 times that they go to the bathroom. My wife complains frequently about the people that don't want to bother the nurse and they just try to get there themselves, even though she's explained that it's for their safety. Next story. Complain about other people going back already when they were here first. It's not that simple. In the outpatient world, there are generally multiple providers, and providers can get behind easily. I'm much faster, appropriately, and I work with a physician who takes long times with patients. I could see 2 of mine while she's still asking about the patient's cousin or telling them what all of her kids are doing. That causes animosity because people don't understand it if they're waiting for her. Also, when I worked as an RN in an emergency department, I don't care if you've been waiting for hours. If all of the other patients coming in have legitimate issues, which makes them a higher acuity, they're going back first. Many people use the ER like a walk-in clinic. Think, oh, I sneezed once today and no other symptoms. Of course, you can see a provider, but the folks who can't breathe are going in ahead of you. Next story. when heavily incontinent patients try to help you clean themselves and end up making it 10 times worse. I get it, sir, you're used to your independence and I am all for letting you do what you can. But in certain situations, I really just need you to lay back, keep your hands to yourself, and let me take care of you this time. Because you got poop all over your hands and bed rails and Pulso-X, and damn it, the bottom sheet. I couldn't avoid the full bed change. And as I like to quote Lloyd Christmas, this is a lot easier if you just lay back. Next story. OR Circulator here. Put your phone down in pre-op when I'm asking you questions. No, pointing to the operative leg when I ask you what your doctor is doing for you is not the correct way to respond. You're an adult. Use your words. I did not ask your loved ones the questions. I'm asking you. I could go on and on. I never expect my patient to know the medical jargon. I get you may not know lumbar laminectomy at L4-5, but tell me back surgery, or he's working on my back, not, I don't know. Also, I don't care if you had to tell 5 other people your allergy list. Tell me when I ask. Next story. I'm an EMT and work on an ambulance, but my silly one is hyperextending your arm to take a blood pressure. I tell all of my patients that when the cuff is inflating, to keep their arms straight but relaxed. It'll inflate too far if your elbow is bent, but if you're flexing your muscles to keep your arm straight, my auto cuffs, they won't work. Then a follow-up point, since I know there has to be people here looking for things to do/not to do. A ride in the ambulance does not guarantee a room in the ER. Your route of entrance, it plays 0 part in your triage category. If you're bleeding out and you come in through the waiting room, you're gonna get seen sooner. If you come in on an ambulance complaining of some random pain, you can still end up in the waiting room. I couldn't begin to tell you the amount of patients I've had that got mad at me because ER triage said what they had wasn't critical enough for a room right away. I feel for these patients, but these were days where the ER was full and previous ambulances had brought in several people from a nasty car accident. Calling EMS does not get you a room faster than the waiting room. So if you feel safe enough to take yourself to the ER, you won't be getting seen slower. Making the call to take yourself or call for EMS is hugely nuanced, and no ambulance will be rude if you decide to call just in case. So if you're unsure, absolutely do call. Next story. I'm going to second the not using the call light. So irritating. Random people just coming up to the nurse's station asking for things when I don't know who TF you are, what room you came from. Now I gotta stop everything I'm doing to figure out all of that and figure out who your nurse is so I can send her in. People, for the love of F, when your nurse tells you what the best way to get a hold of them is, please just do that. Alright, is anybody else feeling secondhand guilt? Not embarrassment, just secondhand disappointment. I feel like I am being languished. It's like when your teacher yells at the whole class, but it was only half or 5 of them. That's what I feel like. Just press the damn button, CJ. Anyway, next story. So, I became a speech pathologist in June after I graduated from my master's program. In my advanced placements, now externships basically, I've been seeing patients for a while now. Number 1 unhelpful thing. Parents, stop trying to correct your child during an evaluation. Please stop trying to interject while I'm giving your child an assessment. It doesn't matter if they're saying a glove or a clown over glove or clown, because I'm only judging the word itself. Stop trying to interject and tell your kid, slow down, take your time. I need to hear their authentic voice. Do you want your kid to get services or not? I can't correctly assess their language or articulation abilities if you're trying to change how they speak. Remember, I'm a speech pathologist. Number 2, please, if your child is in feeding therapy and we tell you to send in foods that your child doesn't like alongside foods they do, stop only sending foods that they like. In a similar vein, send foods that they are curious about, them, or food that looks appetizing. I cannot effectively get your child curious about food that they don't like the look of. Sending in cooked chicken that has visible gristle, bloody bits, and is gray is a recipe for your child continuing to question it. And number 3, have concerns. Please, for the love of God, if your child is clearly delayed or experiencing a disorder in speech or language, acknowledge it. You are not helping your child by putting them in therapy, but refusing a full diagnosis. Nor are you helping by not carrying over treatment at home, hoping it goes away. If your child sees a speech pathologist, it's because they medically qualify for a concern that is affecting their development in some way. Please just acknowledge it. I know it's scary, I know it's hard, and I know it feels like the floor is going to drop out from under you, but your child deserves parents who have those concerns and are actively trying to help them recover or resolve their delays. Next story. Having a conversation with a patient and I say, "Are you having any pain right now?" "No, no pain, I'm good." Then I come back during later rounds, and the doctor says, "Okay, have you been having any pain?" "Oh yeah, all the time." This happened to me so many times I started asking why they didn't just tell me. Their nurse. Many said they didn't want to bother me. Others lied because many wanted to prove to the doctor that they really are sick. People, please, just tell me. I don't want you to be in pain, and having it just delays healing anyway. Next story. It is such a minor one, but asking me a question about what they need to do and then ignoring my answer? I work in medical imaging, and it's not the end of the world, but a constant time waster. Patient comes in for a head CT or a chest x-ray, asks if they need to remove their watch, belt, or shoes, and I say, "Nope, we aren't imaging those areas, so no need," and they hit me with, "I'm going to take them off just in case." Just in case of what? If those things ended up in my image, then I've done a really poor job. I've had people try to move partway through their CT because they remembered some change in their pocket, after I already said their pockets were fine. Not only does it make my job harder, but it makes it longer. A chest x-ray takes like 2 minutes, but now I have to stand there waiting for the patient to tie their boots and put everything back in their pants and pockets before I can free up the room for someone else. It essentially doubles or even triples the time I'm in the room, and it's such an unnecessary delay. I think a lot of people get hung up on no metal for MRI, but do you really think I wouldn't ask you about metal before we get into the room? Anyone who has had an MRI knows you are asked about metal a million times before you even get close to the machine. Also, I'm the professional here. If I say it's fine, it's because I know it's fine. It's not helpful to disregard that. Next story. I just wanted to say that it really bothers me how women's pain is often seen as less than men's pain. Like, say I have some really awful pain and I say I need help, but they just give me Tylenol. But my boyfriend goes in to get a vasectomy and he leaves with heavy painkillers. It is seriously a real issue that makes me so averse to going to doctors as a woman. That, and also because I'm in the US, so healthcare is ridiculously expensive. I don't go until I'm in excruciating pain. Next story. Coming to the nurse's station or flagging us down instead of using the call bell. We work as a part of a team. Waiting for us to come in to do medical things and throwing in a "while you're here" request that could have been done by another healthcare team member instead. Call bell, please. I promise you aren't bothering us, unless you use it multiple times an hour for things you can do on your own. Don't get me wrong. I love helping you get to the bathroom, ensuring dignity, and throwing in a skin assessment, grabbing fresh water, getting you a warm blanket, but I have 15 minutes left on my safe medication admin window and X more patients to see before that window is up. So it mostly boils down to, please use your call bell. We work as a part of a team. Saving tasks for when your nurse pops in puts all of the shared team tasks on the nurse. Next story. Joking around when I'm trying to ask straightforward admission questions. I know you want to be funny, but these are important and I don't want to miss anything. I also don't have the time to drag answers out of you. So if I ask, "Have you fallen recently?" and you say, "I think I'm falling in love with you," or if I ask, "Have you had any thoughts of harming others?" and you joke, "Well, I sure want to," just know that you are making my day infinitely harder. Please, just be an adult and say yes or no. Next story. Psychiatrist here, using jargon or medical terms that they've decided describes what they're going through rather than describing the symptoms themselves. They may think it saves time or makes it easier for me, but are sometimes irritated that I will ask them to tell me what they mean or give examples of every single one. I'm not doing this to make life harder or challenge a patient. I actually need to know what a patient means when they say get manic. Most of the time, the term that the patient has used isn't accurate. So many medical terms have basically been hijacked by social media and twisted or diluted to the point of being meaningless. And most people don't see serious mental illness up close to appreciate what certain terms actually mean in a clinical sense. TV and movies are notorious for showing inaccurate portrayals of mental health conditions. And overall, there seems to be a wildly idealistic expectation of what normal looks like, to the point that people think they are severely mentally ill because they are not happy, perfect, productive robots 24/7. Next story. I don't get this. I've been a nurse for 30 plus years, and this seems like one of those useless power struggles nurses inherently get into. When I worked in med-surg, This bothered me mostly because it usually indicated the family wasn't getting their needs met. There's always exceptions, but if you don't want family members at the station, you need to spend more time going into the room and checking in. I mean, obviously Uber Eats? No, but I feel like most nurses really don't get how hard it is to have someone in the hospital and need to spend some time on the other side of the call bell. Next story. The only concern I have as a healthcare employee is the number of times a patient will be nonchalant about their medication, telling me, "I don't know what I take, I just take what I'm given. I don't know what it's for." That's very scary to me because not all doctors, pharmacies see all medications and supplements the patient is actually taking, and they could really end up doing real damage to themselves. I then take some time to educate them a little or to try in the little time I have with them. Next story. We forget in the face of distress. I recently spent several days in the hospital with my spouse after a serious accident. This person is lucky that they survived. Let's just say we were all very shook up and not thinking clearly. And it would be helpful to leave a message reminder, similar to housekeeping leaves a small information card, regarding the call light etiquette. I stayed with my spouse 24/7 and took over all toilet, hand feeding, and bathroom duties. I asked for water for myself twice, and hopefully this eased the burden somewhere for someone. And I mean this sincerely. Then, simply refusing to make eye contact or ignoring a confused client is less helpful. A kind redirect of, "The call light will get you your nurse to you faster," would have done wonders if I had known that. We forget in the face of distress. So I would like to say, and I've been thinking about this for the past few stories now, and this one really put me onto it, but I feel like there's just a lack of education and information provided to the general public on etiquette about being in the hospital, beyond specific hospital etiquette, I should say. Whether you're the patient or the family member, like OP mentioned, we forget in the face of distress. Like that other OP mentioned, sometimes you gotta remember what it's like to be on the other side of the call bell. And having a sign like housekeeping does to remind you while you're in distress to, hey, press that call light, I feel like would be really helpful. Get Don Draper on the case and make a cool advertising campaign. I don't know. I empathize with a lot of the nurses here that we've read about in this particular video, but I just feel like there could be something done a bit more to educate these people. We don't know what's going on. I'm sorry, but we just don't, and we're nervous and scared. Anyway, next story. So, not a doctor or a nurse. I used to work in a machine shop and had a coworker that used to nick himself while replacing tools in machines. They were big drills and metal working tools with sharp edges. You had to loosen Allen bolts, and as soon as it got loose, you would ram your arm or elbow into the tool if you were not careful. Well, he would cut his arm and put tobacco on the wound because he thought it helped stop the bleeding. He would take a cigarette, rip it apart, and sprinkle the tobacco on the cut. We thought it was not a good idea, but he insisted on doing it. Then the supervisor would take him to the emergency room to get him stitched up. The staff there would then have to clean it up before stitching him up. After about the third visit in as many months, the staff at the emergency room told him that if he came in with tobacco on a cut again, they would refuse to help him because they were afraid he would get an infection and blame them for it. Next story. This one is for the parents. If your kids need a shot or some blood drawn or whatever, don't lie to your kids. It does hurt. If you lie, they won't trust you or the doctor next time. Positive reinforcement like, "Wow, you're so brave, you're doing so great," or a distraction with, "After this, we'll get you an ice cream," are much better ways to help your kid cope. In the same vein, we often cushion our language by turning requests into questions. "The doctor's just having to look in your ear, okay?" Small kids will perceive this as an actual question, and then I will have to betray their no and do it anyway. They don't get a say in the matter. It's an adult decision, but the choice of words really does matter here. Next story. Not a nurse, but I have a first aid background. When people put anything other than burn shield, which is a squishy, jelly wet gauze thing, on a burn wound. For some reason, there is an old wives' tale that putting crap like condensed milk, toothpaste, or butter on a burned wound reduces scarring. I know this because my mother-in-law and her mother, who was an effing nurse in the 1930s to 1940s, believed this and insisted on doing this. So if you do something like this, and you get to the doctor or hospital, they have to scrape that crap off that raw skin, and then there's the possibility for infection, and it goes through the roof. Next story. "Oh, I'm sorry. Well, I didn't want to bother you, which is why I didn't call." Honey, you're here for help, so please ask for my help. You're not a bother, and I'd so much rather you call and ask for help to prevent falls, accidentally ripping your IV out, hypoxia, unnecessary pain, falls, your IV pump beeping, meaning you're not getting your medicine, IV infiltration and extravasation, and falls. Just call me and ask for help, because any of those things I listed use up way more of my time than you just calling me. So really quick, OP used the clap emojis, so I had to spell it out. I had to perform it because I am a dedicated narrator to my craft, so if there's any confusion as to why I did that, that's your reason. Next story. So, there's shaving their site too soon before surgery. Some patients will shave their leg, groin, or belly a couple of days or the week of surgery. A lot of the time, this causes the site to be irritated and even start ingrown hairs by the time you get to us. That's actually not ideal for surgery. It's an infection risk, depending on what you're having done. I've seen a doctor cancel a knee replacement over an ingrown hair that looked infected. Causes an issue on both ends. For us, it's rescheduling, losing time and money from wasted supplies. For the patient, it's just super inconvenient, I would imagine. They probably have to reschedule all of their post-op care too, like ride to and from, time off work, etc. And depending on how far out they get rescheduled, redo all their pre-op things too, because labs and H&P need to be within 30 days at most facilities. Next story. When patients want to offer all sorts of information in no organized fashion, it drives me crazy. I am very thorough in my interview of the patient. I've been doing this a long time. I ask questions pertaining to their stated symptoms in a certain order, and if they wait to answer all the questions, they probably won't have anything more to say. But I always ask at the end, now what things that we haven't talked about do you want me to know? A lot of the times, they then want to start talking about their grandma's cousin who had the same symptoms. I only have so much time to see each patient, and if I exceed that time, the last few patients are going to have to wait a really long time. Next story. EDMD. Try to provide a diagnosis like, so I have this asthma, when you're having a PE, an entirely unrelated story that excludes any medical facts or some uninformative nuance when I am asking a specific, important, and extremely time-sensitive question. Let's write this as if I am a consultant for the pit. 2 scenarios for writers to choose from: inferior heart attack and inferior with thoracic aneurysm. P.S. I've been a consultant on movie sets. Patient in acute chest pain, gray, sweaty, needs to go to the cath lab now. Time is literally heart. Paramedics arrived with, we got a STEMI, inferior, keeps going Brady. Pan to the rhesus room. Nurses busy around patient, doctor talking to the patient remaining calm. Me, the doctor, asking, sir, one more question. Does this pain right now go to your back? Looking at monitors, checking repeat EKG. And the patient says, well, last week I had this back pain in my lower back on the left when I lifted this box, and then every time I move I get this blah, 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 blah. And me, the doctor, experienced empathetic senior doctor, puts hand on patient, gently smiles, caringly to interrupt, and tries to calm the room and distract from all the bells and wires and chaos. Looks patient in the eyes. This is a critical moment, and I say, I'm truly sorry. This is important. You're having a heart attack. There are other dangerous things that can happen. Does this pain, right now, at this time, go to your back? Especially between your shoulder blades. And then from here, there's 2 scenarios. A normal, helpful patient will go, oh no, it doesn't. And the patient helps ensure that there is no thoracic dissection associated to the likely RCA picture of STEMI, goes to cath lab, proximal RCA lesion treated, and lives. Or there's entitled, doctors are all idiots, careless, belligerent, whatever. And the patient will go, I'm trying to tell you. So I hurt my back lifting a box last week and blah, blah, blah. Patient then goes into VTAC while attempting to provide 15-minute story about clear MSK low back pain, which he refuses to stop. Telling for consent, bloods, medication, other discussion, causing delay to the cath lab, dies after resus attempt, or alternatively, thoracic aneurysm, explodes on the way to cath lab. After heparin, patient never answered the question, had symptoms of type A thoracic AO dissection with the MI being from RCA, intimal tear extending to R coroostia, team distraught, ED, MD torn, had decided with cardiologist that risk was low, and MI was severe with imminent cardiogenic shock from RV failure. So yeah, you can get yourself killed when time is sensitive. I'm not saying all doctors who interrupt are right, but if you're told why it's important and it's reasonable and your doctor seems genuinely concerned, please answer the specific question you are being asked. Please help us help you. That was probably one of the most unpleasant stories I've read this year, maybe even since last year. I say this all the time with the medical stories and the military stories too, right in layman's terms. I don't know what the I just read. Like, I kind of get what OP's saying, like, interrupting's fine, but just the verbiage. You just splooged a bunch of terms all over our faces and expected us to take it. I apologize for being crass, but what the hell? Just, nobody knows what you're saying if you're not in the medical field. And it just doesn't make your point go across as well, in my opinion, if nobody can understand you. If you can be understood, then your point gets across well. Anyway, next story. So, not stopping certain medications in time for their surgery day. Think blood thinners, GLP-1s, certain blood pressure meds, and diabetes meds. I provide anesthesia, so now I have to keep a tighter leash on their vitals during their surgery because some standard anesthesia meds will further lower their BP and HR. Some surgeries will have to get canceled because they did not stop their blood thinners in time. And if it's an invasive procedure like spine surgery, ortho, etc., risk of increased bleeding is not worth ignoring this red flag. Not stopping GLP-1s 1 to 2 weeks before surgery puts them at higher risk of aspiration, vomiting, possibly into their lungs, under anesthesia. So my choice of airway protection goes from possibly an LMA to more likely a tube, especially if they have a reflux and DM. Recreational drug use, that also affects anesthetic choice considerations, especially if it's been partaken really close to surgery day. Even smoking cigarettes makes your airway more reactive, sensitive, and increases your risk of laryngospasm, especially when we're putting you under anesthesia, induction, and waking you up, emergence. Gotta have a backup for your backup plan for things that are preventable. Next story. Deciding to stop a med without updating me drives me up a wall. We have these fantastic tools with EMRs where you're connected to your family physician like never before. You can be sitting on the crapper and send me a message saying, "Dr. B, that blood pressure med you gave me made me crap so hard I thought my colon hit the floor." But instead, we wait another 3 months until our next visit where we could have just tried a different med. We're not scary people who don't want to hear from our patients. We really want to help, and most of us would rather make a change before a visit so we don't waste months without doing anything. The most important thing for this is for mental health. Why suffer with depression when you could be making progress? We're not the bad guys that some people make us out to be. We're not out getting wined and dined by drug reps all day long. We're just regular people who care deeply about the people in our practice and just want them to do great. Next story. ER nurse here. The ER is not for every single complaint you've had for 5+ years. Explaining in detail head to toe during triage, thinking all of it is related or will get treated. If you mention XYZ detail, then maybe it will give us more info to connect the dots, etc. You're just delaying your own care, and everyone else's. Tell us the major thing that made you come in today, that needs to be addressed now, more than anything else. You think all of your stuff will be addressed, but I'm sorry. I promise you it will not. The doctor will try to address what they think is the most important thing. The rest, they will refer you to a primary care provider if it's not considered serious. And by the way, I wish we all had more access to primary care. It sucks that we don't have a universal healthcare system in the US, but the ED is not for this, and it creates lots of problems overall when people use it as primary care. But if you're a legitimate fall risk and not sure if you can do things on your own, please do not try to get up just to be nice and save us the work. We appreciate the effort. That's thoughtful of you. But if you fall, we have to do a lot of frustrating, annoying documentation and explain why you fell, and we basically get blamed for it. It's really bad for us. Next story. Orthodontic assistant here. Telling their kids how terrible the impression is going to be while I'm getting ready to take an impression? If the kid has no reference point for what's about to happen, and you are already telling them they are going to gag to the point that they are shaking like a leaf, then they will in fact gag, or worse, puke. Luckily, once I can see things are going sideways, I can usually use a couple of tricks to turn things around. But it boggles the mind why parents think it's helpful to scare an 8-year-old. Next story. Failing to tell you essential information about their medical history. For example, coming to the ER with nausea and vomiting. getting a whole workup, including a pregnancy test. And then when we come to tell you that you're pregnant, you say, "Oh, yeah, I know." There's also, "I don't have any medical problems." Okay, do you take any medications daily? "Yeah, my diabetes medicine, and something for my blood pressure, and they put me on something for my heart failure last week." Next story. I'm a lab guy in an ER, so I don't really interact with patients very much. As for things nurses do that annoy the crap out of me, bringing me samples that don't have orders. I get that things are busy and sometimes it's easier to collect that blood now while you aren't busy with anything else, but it makes things a lot harder for me. 1. A lot of samples have limited stability depending on the test, so sometimes that blood collected an hour ago was only good for 30 minutes, so now it's useless. 2. My generalized anxiety may be to blame for this, but now I have to stop what I'm doing every 5 minutes to check if there are orders yet on those samples. 3. Nothing drives me up the wall more than when a nurse calls to ask why I haven't started something that they only put in orders on in the last 10 minutes. "I brought that urine 2 hours ago and put the orders in 7 minutes ago. Why isn't it showing as received yet?" The answer is, I'm not glued to my computer constantly waiting. I'm running samples, calibrating the machines, running quality controls, and a dozen other things that may not even be related to the patients currently here right now. Next story. Deciding what's important and not for me. "So, sir, have you ever had any operations?" "Well, as a kid, but that was a long time ago." Nope, wrong answer. Childhood is part of the ever. "Do you take meds?" "Well, just a small vitamin D supplement, nothing major." Wrong again. We are establishing exactly how much vitamin D you eat. Or on the other end, I have a cancer patient who is insistent on talking about their knee problems. They have a diagnosis and are waiting for a replacement. Like, "Sir, I asked if you cough up blood or if you're having trouble breathing, not about your knee." Next story. Not answering a yes or no question with yes or no. "Do you have a pacemaker?" I'll ask. "No, my heart has always been healthy, but when I was heavier, I did have this episode where I ran up some stairs and had palpitations. My husband had the same experience when and so on and so forth." I never get mad because they are so clearly trying to help, but the fact is that everything after that no is just taking up time. Next story. Please do not lift your arm as I'm trying to scan your armband. Then it becomes an awkward moving target. Also, please don't raise your arm in the air as I'm trying to do a blood draw or start an IV. Said with all of the love in my heart, put your freaking arm down. Then please don't tell me you have high pain tolerance. I don't care. Just tell me your pain on a score of 1 to 10, and if you take anything at home, I'll advocate for you like hell. Believe me. If there's nothing on board, but the doctor is going to instantly hang up on me if I say, "The patient says they have a high pain tolerance." Next story. Bringing long, wordy documentation of their health records. I hear people complain all the time that they brought their giant binder in, and the provider took a 2-second look at it and then gets mad about their work being ignored. Physicians don't have time to read all of that. You really need to boil it down to a sticky note with dates, symptoms, specialist appointments, diagnoses. The giant packet is good to have for reference in case they want to flip through specifics. Next story. I am not a nurse or a doctor, but I work with nurses and doctors at my current job, and I am friends with nurses and doctors, and I am someone who had to go to the ER several times last year. So my nurse and doctor friends almost slapped me in the face for trying to contextualize things while I was being asked questions in the ER. For example, rate your pain on a scale of 10, 0 being no pain and 10 being extreme pain. Well, I kept ranking things lower than I should have ranked things because I thought it would probably hurt a lot worse if my arm or leg had been cut off or if I'd been shot. But that isn't what I was being asked. I was being asked in that moment, was pain significant? I should have ranked it pretty high because it was making me dry heave and I was pale and sweaty. None of that had ever happened before, even when I've been pretty hurt. So in trying not to sound too dramatic and attention-seeking, I actually made it seem like my symptoms were significantly less than they were. Thankfully, being friends with healthcare providers means that they sometimes will ignore you when you tell them not to come to the ER. And then they explained to me how I was unintentionally making it harder for the doctors and nurses to properly assess me. Next story. When I was an ER RN, I would hate when people would come and not medicate their kids or themselves for pain because they wanted us to see it was real. Sometimes you wait for hours, and I don't want anyone to suffer during that time. I promise most of us believe you if you say your kid had a fever or if your stomach hurt. Also, please use the call bell and don't try to get up. Then, working in the OR, do not try to jump over to the OR table as soon as you come in the room. Chances are anesthesia gave you something. We have tools and tricks to safely get you over. Just let us do our job. Next story. Not using the freaking call light when something's wrong. I get that they want to be a good patient and not be a bother, but I was working a night shift once, running off my feet, and had a patient on heparin drip. He had COVID, so protocol was to keep the door shut, so I couldn't hear anything. When I rounded on him, the IV was beeping that it wasn't running. I asked how long and he said, "About an hour. I didn't want to bother you." Also, when they're in a lot of pain and asking me for pain meds every 2 hours on the hour, but they don't want to seem drug-seeking to the doctor, so I can't actually get better orders. Next story. When they are oriented enough to know better, but try to get up to the bathroom without help. "I won't fall, I won't fall." Famous last words. Trust when I say I would rather spend 5 minutes helping you to the bathroom than have you get a potentially fatal injury from a fall. Or deal with the documentation and scrutiny if you fall, even if you're fine. Just push the button, please. Then moving around, shifting and scooting when we're trying to arrange teleleads or fix other cords, hoses, or tubing. Just stay still unless we ask you to adjust. Same if we're changing your bed, your brief, or anything else. We will ask you to do what we need. Otherwise, you're making us work harder by trying to chase your movements to get it done. And finally, do not touch your IV pump. Family and patients need to call out if it's beeping. Do not press buttons, and I don't mind to come check it, and sometimes it is beeping to alert something that needs to be titrated, ended, or changed in some way. But do not change pumps. Thanks, but please don't. Next story. Parents who insist on staying with their fully adult children just because they had a procedure and needed to stay for observation. They are an entire person who has a family, wife, husband, and/or children, and can speak for themselves, yet you insist on sleeping over when they have told you not to and keep interjecting when we ask them any questions. Then you expect us to wait on you like we're hotel staff and not in a hospital. Please go home and let your son or daughter talk for themselves. I have had patients call me in when their parents go down to the cafeteria and beg me to kick them out. I've also had family members call and tell us to ban certain visitors from coming to visit due to the amount of stress that they put on the patient being there. Your loved ones need to be watched by the doctors and nurses, not put under undue stress because they feel they have to entertain you and keep dropping hints that you can go home. They need to rest and can make decisions for themselves. Please, let us do our job. I promise we have visiting hours and you can come back. Less stress during their stay can help them get out faster so they can get back home. Next story. Come in for a real medical emergency but refuse literally all treatment. Had a patient come in with free air and refused surgery or any interventions. Wanted to go home instead. Because I was a resident, I wasn't allowed to just let them sign a paper and go home to die, but had to spend hours explaining to them over and over that they were probably going to die until they finally agreed to surgery. The patient lived, but I had better things to do with my time, like catch a nap. Point is, I will never care about someone's life more than they care about their own. If you come in and don't actually want treatment, then please stay home. Next story. Not taking pain medications because they want doctors to believe them or they want to be accurate. Here's a tip. If you have symptoms that come and go and you're worried that they will resolve when you step into the ER, keep a symptom diary. I don't want you to be sitting in pain for 3 hours because you're worried I won't believe you. Plus, the pain's response to analgesics is also a key diagnostic clue. If you're in pain, take something for it. Next story. So, what brings you in today? Then proceeds to tell me loads and loads and loads of information about everything that has gone wrong for them medically since the last time they visited a doctor. And the only thing I'm going to say in response is, okay, that was a lot of information, thank you. So what brings you in today? Please, people, keep your answer to this question succinct. We need a headline, not the whole story. Your story, it goes in one ear and out the other if you give it unprompted. Next story. Family members answering subjective questions. Patients embellishing symptoms to make the doctor take them seriously. Patients not answering the question asked to them instead of telling me something they think is more important. Coming in and immediately diagnosing themselves instead of telling me their symptoms. For example, I have strep throat, I just need an antibiotic, doc. Then telling me their sister, cousin, brother, roommate had the exact same thing and then suggest what I need to order. Telling me to just look at their chart when I ask about allergies, meds, past medical history. Bringing in their vomit for me to examine. Trying to use medical terminology they obviously heard on TV, not knowing the definition at all. Telling me their entire medical history, starting with, when I was a kid 45 years ago. And it has no relevance to their current chief complaint whatsoever. Then there's telling me you had a fever and you never took your temperature, and taking an ambulance into the ED for faster service. Next story. When patients say, I have a high pain tolerance, and then refuse to rate their pain on a scale, I'm not doubting you, I just need a number so I can document it and actually treat you properly. It's not that bad means something very different to everyone. For some people, that's a 3. For others, it's an 8, and they're trying to be tough. We're not asking to judge you. We're asking because insurance, protocols, medication dosing, and even shift handoffs depend on that number. If you tell me it's a 2 when it's really an 8, I can't advocate for you the way I need to. Trust me, we'd rather treat your pain than guess at it. Next story. Coming in too soon for acute illness. Yes, if over the last 2 days, you or your child went from being totally normal to feeling like you're going to die, being unable to breathe or completely unable to get out of bed, tolerate oral hydration or other severe symptoms, that is worth being evaluated ASAP. But coming in because you've had 3 to 7 days of a sore throat or occasional cough or fever or any of the other generic sick symptoms while still being mostly functional and able to eat or drink, especially during sick season, there's about a 99% chance you have one of many viral illnesses that are going around right now and just need to wait it out. If you really want to be helpful, you can take a home flu and COVID test early on, since those are the only 2 we can really do anything about. Within certain time frames, and if you meet certain criteria, most healthy people don't need Paxlovid. But if you're still not getting better after a week, or you get better then get worse, then we'll talk about things like chest x-rays and antibiotics. The only valid reason to come in that first week, again for non-severe symptoms, is if you need a note so that our capitalist overlords will let you stay at home and rest it off. Additionally, there's acknowledging that our imperfect flesh sacs do lots of weird, uncomfortable things that aren't necessarily a chronic medical problem, especially when we're stressed and as we get older. We as a society are all under constant stress, and we are fed a diet of processed garbage and almost completely sedentary, and that makes us feel like crap and can give us all kinds of weird symptoms. I will always test you and rule out any underlying medical problems that could be causing your fatigue, dizziness, pains, or GI issues, or whatever other vague symptoms you present with, but the majority of the time, those tests are normal. And if I had a nickel for every time symptoms improved after switching jobs, losing 10 to 20 pounds, quitting drinking, smoking, finding a new hobby that gives you joy, starting to cook your own food, or other lifestyle changes that are admittedly easier said than done, I would have a weirdly huge amount of nickels. And the people that have made some of those changes but are still having problems are much more likely to get a quicker diagnosis and/or treatment, since we don't have to waste time ruling out the lifestyle factors. Next story. Also, I understand that sometimes others need a support person during visits, but when I ask the patient a question, I want them to answer. If there is no concern about cognitive impairment, I need to hear the info from the patient. I've missed spousal abuse on one occasion because I thought the spouse was the more with it one, when in actuality, the patient was being abused. So now I insist that the patient answers, and I prefer if folks come by themselves so they feel comfortable talking to me. All right, class, we're at the end of the video, and what did we learn here? Say it with me. Press the call light button. If there's anything you can take away from this video, it's probably that. I also didn't know about the falling and paperwork thing and, the nurses getting whipped by their shift managers. So let's make sure that they don't get beat up by their supervisors. But anything else I wanted to say, I've already said it throughout the course of this video. But guys, thanks for coming back to the channel. Thank you all so much for watching, commenting, and I hope you have a good one. Bye-bye!